I'm going to give instructions on how to wear a mask correctly. There seems to be a lot of confusion on why we are wearing masks or how to wear them in the right way. Okay, first of all, why do we wear a mask? This has changed over the last year, and that's why everybody's confused. We got different warnings. Part of it was because there was a mask shortage. Part of it was we didn't really understand what they did. It is correct. Some masks do not protect you. This is an ordinary mask. This one is worn for one reason. It decreases the spread rate. That's the reason we wear this one. When properly done, the amount of expelled particles, especially someone like me who's sometimes told I talk too loud or I spit at people, or if I accidentally sneeze or cough because I'm sick and I don't get my hand up in time. This blocks all those particles. Think of me of having a spray bottle. This is the barrier blocking it. Very good. It blocks it. Okay. Very nice. So what this does is I'm going to infect less people. If I wear this instead of when I spit and talk and yell or cough, instead of all those particles going out, only 1/6. Think of a lot less get out this way. And so instead of me infecting 6 people, I might only infect 1. Why is that important? The spread rate. If I'm infecting 6 and they infect 6 and they infect 6, all of a sudden we've got an explosion. If some of us get really, really sick, old people like me, not all of us are going to survive then. But if we keep it low, us doctors can then give all our attention to the handful of people that are sick. So this mask partially protects you. Probably based on this, only 1/3 of airborne particles may get through, and they may be smaller. Of course, it depends on the quality of the mask, what type of material, how much it blocks. I mean, you can wear 2 masks. Something like this helps somewhat too, depending on the weave of the material. Putting pantyhose on it really increases the risk. It also is, good for bank robberies then. But that's another issue. So this is to protect other people, and that's what we do. We're human beings. We look out for each other. Even if you don't care about yourself, that's fine. You don't have to care about anybody, but you do have to be part of society, and you have to care about everybody else. And a lot of us feel that mask wearing should be mandatory for everybody outside within 3 to 6 feet of anybody else. That means other than you being in an open area by yourself, when we're outside, we probably should be wearing masks. Likewise, if you live in an apartment with 5 other people who are coming and going, probably start thinking about wearing this too. Okay, now, you want to protect yourself. You need a better level mask. Now, the ones on the shelves are these. Now, these do protect you well. See, it's a N95, but it has an exhalation valve. This is nice for me. I mean, it does make me cooler when I breathe out. Instead of that hot air, and I would pinch this to make it really fit well. But when I wear this and I breathe out, it makes it really comfortable. The air goes out. It's maybe a minuscule risk because of that exhalation valve. The problem is this doesn't help other people as much. My breath is still getting out there, although it will block probably to the equivalent of this one, because if I'm throwing large spray, it just can't get through that valve that quick. So, but that's a reasonable. It's not reasonable if you were in the ICU treating COVID patients. Now here's an N45 of one type. Here's another N45 of one type. Now see the N45, you can use this metal bridge to fit around your nose. So these are the ones that I wear to protect myself, because not only am I not potentially infecting you, but when I wear this, it raises my level even more. I mean, this makes it so that only 5% of the very tiny particles can get through. They make N99s and even N100s, but it's hard to wear an N100 tightly fitted for more than a little bit. But the key on wearing a mask, and this is where 50% of the people coming into my office get it wrong. You don't wear it like this. If I sneeze, boom, still out there. I'm still doing that. You can't talk to me like this. I'm still spraying particles all over. This does not work. Maybe in the winter it'll be warmer. Maybe it hides some mental fat, although come in and we'll true sculpt that area instead. This is not the ideal way. We can surgically treat that too. But you want to put it up like this and like this. If you come into my office, I want you talking to me like this. If I need to see something, I will say, hold your breath, take off your mask, let me look, and then put it back on, like this. That is the correct way. In a second, I'm going to talk about face shields, okay, as the second part. So, regular mask should be required for going outside in crowds. Don't be a Karen, don't be a Chad. Please use this to protect your fellow human beings, even if you don't care about yourself, okay? This and this are N95s. These are good for people who have health problems, people more at risk, or if you want to protect yourself. There are also KN95s, which are the Chinese made, as long as we're certain they're not counterfeit. And then, of course, there's the KF94s from Korea. But in a second, I'm going to talk about the face shields.